So now going into the panel discussion, throughout the conference, and Chelsea had mentioned that too, we are trying to give voice to a whole range of different people working in the field. We've already heard about girls themselves shaping innovations to meet their needs. We've also heard about from government and businesses removing barriers through MHM. In the next 30 minutes, we want to hear from international donors and funders about their perspective on innovations, how MH fits into the agenda, and what innovations they are currently most excited about, and where they see major gaps, especially in the context of COVID-19. Although we recognize that a majority of cost is associated with MHM, borne by women and girls themselves and their households, international donors might still play an important role in funding ideas that have yet to prove that they work at scale or that they're viable in the long run. So for the moderation of the panel, I will hand over to Lisette. Lisette is, as you know her already, Senior Advisor for Sanitation and Hygiene for UNICEF at headquarters. Lisette, over to you.
Hi, can you hear me?
Yes.
Okay. Wow. It's only 2 hours into the conference, and I mean, there is already so much to learn, to pick up, and I think the two reflectors and Janita, your summary is maybe the best way to move into a panel discussion. We know that we are. Throughout the world, the innovators are creating solutions that change life. We know that it's for the girls, with the girls. It's context specific. It's a partnership, the new leadership. It all came through. And what we try to see is that many of innovations happen locally, but what we're also looking at are how innovations that help probably thousands in one country can move and deployed in another country with the potential to catalyze improvements for millions of girls and women globally. And it's not always happening by itself, and often not. And so I think also the last presentation indicated that partnership, all the presentations indicated partnership is important. And so we are interested to see what is needed to identify promising innovations and ensure that these can be easily replicated, set up, and utilized anywhere. So scaling up of innovations is so critical, and therefore we see that many organizations, support organizations, technical organizations, often are involved and try to identify and launch innovations across multiple sectors and in complex situations, including emergencies, or engage in platforms to connect millions of young people to decision makers, help influence policies, engage the most vulnerable communities. So providing access to information and products. So what we would like to do in the panel is to hear from a couple of champions in either in the gender or in the innovation sector to get their views on innovations. And we have 4 panel members here. We have Christina Ljungberg, co-founder of The Case for Her, which is a philanthropic investment portfolio addressing the key women's health issues of menstruation and female sexual health. Before The Case for Her, Christina established the nonprofit foundation Giving Wings, and she's also founding member of the Maverick Collective, an initiative to eliminate extreme poverty created by PSI in partnership with the Bill and Melinda Gates Foundation. And then she's active board member of both Acumen and AfriPads. And then we have Liat Gellis, the Director of Open Innovation at Grand Challenges Canada, where she oversees the Grand Challenges Canada's growing portfolio of impact investments to the transition to scale and STARS programs. Liat brings robust experience in early stage impact investing, having previously worked with organizations like Social Capital Partners, managing a portfolio of unique pay for performance investments, and grassroots business front, advising social enterprises that create sustainable livelihoods for low-income communities in East Africa. So then we have a third panel member, Poulain Letzi, the coordinator of the African Coalition on Menstrual Health, based in the UNFPA East and Southern African Regional Office in South Africa. Worked in public health and development communication, managing programs on HIV, gender, SRHR, and human rights programming for nearly 2 decades. She provided technical advisory and policy support to several government ministries and departments, as well as national and regional networks of CSOs. And our last panel member is Sylvia Cabus, is the Senior Gender Advisor supporting the Water and Education Offices in USAID's Office of Gender Equality and Women Empowerment. Prior to this, Sylvia provided technical assistance on an agency-wide institutional gender assessment for the Department of State's Office of Global Women's Issues, and was one of the gender advisors for USAID's Bureau for Food Security. Overseas, she worked for Catholic Relief Services in Kenya, Morocco, Mali, and Burkina Faso. Worked also with HIFRA International, Handicap International, OFDA, and Development Technical Assistance. So we have a very rich panel, and we are very pleased to have you with us. We are very honored, and thank you for being here. So let's get to know each of you and your organizations a little bit better. So in a few minutes, could you give us a short overview of your organization's priorities for innovation and where menstrual health and hygiene fits into these priorities? So Christina, shall we start with you? I hope you have the microphone, please.
Hi, thanks for the fantastic introduction. It's a real pleasure to be here. As mentioned, I'm Christina Ljungberg, and I'm a co-founder of The Case for Her based in Stockholm, Sweden. And as mentioned, we're a little different. We're a philanthropic investment portfolio using very flexible, risk-tolerant capital to support innovations and de-risk investments in menstrual health. So thank you so much. I would say I really struggled with the first question because all of our work is related to menstrual health and innovation, basically. Our priorities are simple and twofold. We want to get menstrual health on the global health agenda, and we really want to support the movement of additional funding into this space. In order to achieve that, I think we've tried to take an innovative approach as funders, actually, really taking a learning portfolio approach where we're not focused actually on the impact of our own portfolio. We're focused on learning and getting smart and helping the rest of you advocate and move the space. As far as where we really have some of our priorities right now to support us to do that, I think it's good to really highlight that we feel that it's important tool to get menstrual health on the agenda is going to require that we continue to keep linking it to other areas across the sector, such as health, education, gender equality, really driving home how it's fitting into the Sustainable Development Goals. So for us, a specific example would be around our work linking it with sexual health and reproductive rights. As we all know, menstrual health is deeply entwined in sexual health and reproductive rights. Where women and girls have questions about menstruation, they're also going to have questions related to their sexual health. So to highlight 2 innovations that we're thinking about and trying to apply to that specifically, it would be using new tools such as human-centered design, where adolescents join in the design process and come up with solutions for their own challenges that they're facing related to menstruation. And making sure that they're involved with the process really ensures that they're being provided with the information that they want in order to get them the information that they need. Moving forward, I think a second area to highlight that we're really focused on is innovative partnerships. None of us are going to do this alone. And because there's so many areas where menstrual health is overreaching again, the days of working in silos have to be behind us. So innovative partnerships and collaborations are definitely the way forward in our work. And this was beautifully highlighted by the most recent FSG report, Advancing Gender Equality by Improving Menstrual Health. We've also been able to get a bit creative in the partnership space and fund innovative collaborative projects like one that we've had with our longtime partner, PSI, Population Services International, that resulted in a technical brief specifically around menstrual health and SRHR. And talking about innovative partnerships, I can't pass up the opportunity to highlight the launch of the Global Menstrual Collective this past year with the support of WaterAid and WSSCC. Today, that collective includes about 33 organizations around the world working to incorporate menstrual health into policies and use evidence to drive investments.
Thank you so much, Christina. That's really a comprehensive kind of introduction of where MHM menstrual health sits in your organization. Let's move to Liat. Can you give a short introduction of your priorities related to innovation and where menstrual health sits?
Great. Thank you so much, and thank you for having me. So Grand Challenges Canada, this year we're celebrating actually our 10-year anniversary. And over the past 10 years, we've funded over 1,000 innovations in 95 countries. And our menstrual health portfolio is a small part of that, but one that is important and growing for us. So we currently have 3 pillars. We fund in humanitarian, Indigenous communities in Canada that was launched this year, and our largest pillar, which is development innovation. And under development innovation, we have invested in 25 menstrual health innovations for $4.5 million over the past, I'd say, 5 years. Many of those innovators and entrepreneurs might be on this call right now. So our larger focus is really around reproductive, maternal, newborn, child, and adolescent healthcare. It's always a handful. And that's where our menstrual health portfolio falls under. And like Christina said, for us, it's largely also within our purview of funding sexual and reproductive health and rights as well. In terms of focus and priority, other areas, we fund around the world with our menstrual health portfolios, largely right now concentrated in sub-Saharan Africa and India, but we do have some investments in Nepal, Indonesia, and Cameroon. We're funding at both what we call at our seed or pilot stage, so $100,000 investments, and we've also made 6 investments at an earlier stage of up to $1 million per innovation. In terms of how we think about innovation, there's obviously a lot of product innovations that we see and that we support, but we're equally excited and look for social or business innovations and new ways of doing things amongst the potential innovators that we look at. And different ones that we're excited about, range from Francois's work with Sacco Day in Burundi, who we're supporting, to Diana and Audrey and their work in Mozambique with B-Girl. And I'm not going into these too much because my gut is that most of you might know about it, but otherwise I'm happy to share more about the incredible work that our innovators are doing. And some of the great work that we're funding in India as well through Akar Innovations and Sorel Designs, who really have unique ways of thinking around their business model and how to try to scale profitably. So our focus, our priorities continue to be to invest and support more innovators at seed and early stages. And to be honest, our priorities are to be as diversified as possible, is not to be prescriptive in the types of solutions we're looking for, but to really promote different approaches and strategies and products, so that we can find the right solution for the right context, and scale those. And I'll just stop there. Thank you.
Thank you so much. It's interesting to hear from both of you that I think in the first, Christine said the learning approach, and you say also we don't want to come with fixed solutions, but really be of help. And the second thing that comes out of the two of you is so clear that it's part and parcel of a larger agenda. If we want to really move the agenda and move the needle. We go to the third panel member, Puleng. We are very interested to hear from you. What is your thought about where does innovation sits in your coalition, and where this your coalition is about menstrual health, but maybe a few words on the innovation part. Over.
Thank you very much. As we're all aware, the coalition is really supported by UNFPA, and UNFPA being the Sexual and Reproductive Health Agency. The assertion within the organization is that menstrual health management is a critical component of the SRHR agenda. And MHM has been part of what UNFPA has been doing over the years, and now being very deliberate about the integration of MHM in its programming. And that cuts across a lot of areas that already UNFPA is doing work in, which includes the distribution of supplies, safe sanitation facilities, including dignity kits, but also really improving MHM and human rights education and information across the board, and using existing programs, because the whole issue is that MHM is not a new program, but should be integrated in the work that is ongoing around comprehensive sexuality education, around issues around youth programming, ending child marriage, ending FGM. So that whole integration is really key to what UNFPA aims to do. And this cuts across supporting national health systems around issues of data and evidence, partnerships, collaboration, and coordination, which then led to the establishment of the African Coalition for Menstrual Health Management. And the coalition, of course, came about from the first menstrual health symposium in East and Southern Africa in 2018, and really to strengthen the coordination among stakeholders and build on to the evidence base, but most importantly, to be able to better transition research into action and vice versa, while we support the multi-sectoral policy making. So the innovation really is that the coalition brings together various actors as a collaborative platform, and people, organizations, entrepreneurs at all levels, from policy to community, doing a lot of really great things. So the whole innovation is to have all these in one or within this collaborative partnership, where we're doing stock taking, what is happening where, and how do we support the development of regional guidance and standards, partnerships, fostering the evidence generation and knowledge sharing, and creating a platform for advocacy and dialogue, which has been missing in terms of us speaking in one voice. So that translation of policy into action and using local solutions to inform policy and programming has been the key to what we aim to do as a coalition. So the priorities really in terms of innovation is to have MHM as being integrated in the work that is happening around SRHR, human rights, HIV, WASH, education across the sectors, and to highlight and emphasize it as a multi-sectoral issue. So both in development and humanitarian settings, because most of the work in some instances has been in humanitarian settings, but to also provide it in a very comprehensive manner. Hence our focus is see development and standards for products, which have really informed the innovation in the products that we see out there, have informed the development of some of these standards of products. Thank you.
Thank you. Thank you so much. We go on to the last panel member, Sylvia, the Senior Gender Advisor from USAID's Office of Gender Equality and Women Empowerment. Please come in.
Great. Thank you for inviting me to participate in this panel. I am happy to see the great level of participation both on the presenter side and also on the participant side. So I'd first like to start talking about USAID's commitment to innovation. We are committed to innovation and trying to set up the systems and processes and also the motivation and encouragement to be innovative. So I feel really lucky to be able to work on the MHM agenda in this context, which is really supportive and enabling. We actually have an entire bureau called the Global Development Lab that is solely focused on innovation, and innovation is also part of the mandate of every regional and technical bureau at USAID. And that commitment is going to be further strengthened when USAID's transformation is finished, because my office, the Office of Gender Equality and Women's Empowerment, will be part of a new bureau called Development, Democracy, and Innovation. So we'll be able to foster even more strongly the cross-fertilization that we have across sectors with our colleagues and with our implementing partners. I'd especially like to emphasize that MHM fits into our multi-sectoral approach toward innovation and as part of our overall work on gender equality and women's empowerment. We also like to work on themes or areas that have been traditionally or historically been underrepresented or under-researched. For example, gender-based violence in the environment. We have issued guidance and commissioned research activities, and we also last year had a special funding opportunity for implementing partners to work in that area, and that area does include WASH. And we consult regularly with our colleagues who work on mental health issues to think more strategically about how we work on sanitation-related psychosocial stress, which we know is an emerging area with relatively little research and also has tremendous implications on the ability of women and girls to participate in public life. Thank you.
Thank you so much, Sylvia. So it's interesting to see how different organizations, I mean, they all have innovation or gender and menstruation at the heart. And what comes out is that it always needs to be part and parcel of a wider coalition and a partnership approach based on the local context. So very insightful to hear from you. We are running a little bit out of time, but if we could just take 4 minutes for each of you, 1 minute. Can you give in 1 minute and your most exciting innovation in menstrual health and hygiene, or what is exciting you most and what you would like to see further develop? And let me start with Liat. We do a little different sequence. Liat, you first, and then Puleng, and then we go down the line. Okay. Liat.
That is such a hard question.
Yeah, I know, and that's why we ask it you.
To favorite. Yeah. You know, I'm not going to pick one amongst the 25 that's a favorite. That's too hard of an ask. But what is exciting, and I think what I alluded to before, is beyond the product innovations that we're seeing from many of these are other aspects of how they're thinking through their business models, of how innovators or entrepreneurs are marketing or educating or reaching out to women and young girls those are the types of things that really excite us. I think for us, seeing more funders around the table is where we definitely see a gap. I know Christina from Case for Her Well, we have a match funding requirement. And so we see a lot of the same funders around the table coming in to co-invest with us. And it would be great to see some new faces. And I guess I'll stop there. But sorry, I can't pick up. I'm not going to do that. But I appreciate the question.
But we still pick up from you the systems approach, really the whole approach around market-based innovations and the processes, and to see new faces, new partnerships. It came across. Thank you. Let's go to Pulang. Your 1 minute challenge to get it across.
All right, I had to unmute. Thank you very much. Yes, it is a tough one, but what has been exciting for me has been the flexibility and agility of some of these organizations, especially the social entrepreneurs, in being able to adapt to some of the conditions and situations, especially now in this COVID era. One major thing that has really excited me have been the gender transformative and culture-specific or responsive innovations around menstrual health and menstrual products, where, making an example, we'll go beyond the 1 minute, but also there have been very exciting issues around waste disposal, as well as highlighting and emphasizing the opportunities for integration, given the work that we're doing, and some really great youth-led entrepreneurship efforts which have taken place, and the use of environmentally friendly materials, such as ones done by like the Gateway Institute in South Africa, and so on, using natural materials, but also making MHM an opportunity to further enhance the livelihoods of people, while at the same time taking care of their sexual and reproductive health and rights. Thank you.
Right. So from you hearing the adaptability and I would say real entrepreneurship of the entrepreneurs, the innovators in this era, I think that's a very important one, and leading it also the environmental reflection and perspective in the development of products. Thank you. Very, very, inspirational to hear that. We move to Sylvia, and Sylvia, we before we give you the 1 minute, just want to share with you that there was in the Slido a comment that people were so happy to hear you talk about psychosocial and mental health issues and turning research into action. So just wanted to share that with you. Your 1 minute to share your excitement, most exciting innovation idea.
Sure, I'd like to stay on the theme of research and building our evidence base. I'm very excited to see all the innovative approaches and methodologies that are being used now for research and evidence, because if we have good data and good research, that leads to better program design and implementation. And I'm especially interested in strengthening the links between MHM and women's empowerment, including that of girls and young women outside of the school context, and also linking MHM to economic opportunities in the workplace for women overall. So, and of course that could mean young women as well. We use the DHS age band of 15 to 49. So I'm really looking forward to hearing what comes next.
Thank you so much, especially for referring to these opportunities for young women as of the age of 15 and the whole link to women empowerment. Last but not least, Christina, your 1 minute of reflection and excitement that you want to share with us.
Great. Well, I would have used my 1 minute to talk about my excitement around metrics and impact, but everyone on the call gets to listen to Julie Hennigan in a couple of minutes. So I'm going to leave that to her. If we're going to move more funding and get what we want to get done in this space, we've got to be able to measure it. However, the one thing that I'm specifically today excited about is in these times of COVID, watching as organizations are figuring out how to move really fast and flexibly and leverage their strengths and produce new ways to get information, products, and services out. They're also at the same time really designing methods that are going to ultimately become the new models of coordination and rollout of programs after the pandemic. So maybe leaders in the space that I'm seeing do that right now. Again, PSI developing a global response team and really making sure that they're not having to redesign in all the spaces. So yeah, super excited about what's going to happen after we come out of this.
Thank you so much for, actually what you're saying is that through this change and with the resilience and the capacity that human beings have, we're probably not letting a good crisis to go to waste, and that the new models that are being developed may lead to different ways of working. As I said already at the beginning, partnership is the new leadership. So new ways of partnering and new ways of new models of service and product delivery and development. So really exciting. Thank you so much, all four of you, for your thoughts, for your inspiration, for the support that you give to many of these innovations and tryouts and patience for sometimes falling and getting up again. Failure is part of success. And I think with Christina, your comment that where finance and investments go in, metrics are important. I think it will then be good that we move on to the next phase of the conference. Thank you so much for your thoughts and your reflections. Over to Janita.
Thank you very much, Lisette, and thank you very much to the four panelists. This has been really, really interesting to hear the different perspectives and how MHM is integrated into so many other sectors. And we've certainly heard already in the morning the challenges that poses in coordinating everyone and bringing it up on the agenda.